maybe 80–90% of all our cases, we are good enough with a manual examination and with a simple X-ray, so it's enough for our patients. When we get to the rehabilitation, usually we need to use the instrumental diagnostics, the articulator. After getting 3 days of cold compresses, we change and switch to warm compresses, also 3 times a day for 3 days. We got this situation. You see, this is a demonstration of the destruction splint or decompression splint, but this doesn't work if you don't get a help from a physiotherapist. In this special situation, this third dimension of the vertical dimension in adults, we need the help and the support of this physiotherapist.